Our next speaker is Patrick Aubert. He is a graduate student at Simon Fraser University, pursuing a master's in arts degree in gerontology. Patrick's main research interest is in examining how older adults identify with the categories and labels of gender and sexual minority, how that identity influences the ability to access and receive services and supports required to age in place, and finally, how that identity intersects and interacts with other socially imposed categories to control and limit access to health and social services. Patrick's been working with Dr. Gloria Gutman and Brian DeVere on the fostering end of life conversations, community and care amongst LGBT older adults project since its inception. And he's happy to share some of the findings from the study pertaining to the specific challenges faced by older gay men in planning for the end of life, and offering some insight into the challenges of understanding the needs of a diverse pan-Canadian community. Please welcome Patrick Aubert.
Hi. Thanks for having me here. It's really a pleasure to be here. So, as Patrick said, this is part of I'm basically presenting some information from a part of a larger study that I did with Dr. Gloria Gutman and Dr. Brian DeVries out of Simon Fraser University. And the original study, the major study, is called Fostering End-of-Life Conversations, Community and Care Among LGBT Older Adults. And this is a pan-Canadian study. We did it in collaboration with co-investigators across the country, and it was funded by TVN, and I want to acknowledge that gracious funding because it certainly helped us a lot in terms of doing our research. So just to give you some background on the major project, it's basically a three-part national project that we did. The first part was we conducted focus groups in 5 locations, so here in Vancouver, Edmonton, Toronto, Montreal, and Halifax. And we looked at we engaged LGBT older adults and care providers to these older adults with the goal of understanding the issues and the extent to which they plan for end of life. The second part of the study was to engage in town hall meetings in all 5 locations, and the reasoning behind that was to raise awareness for the need of end of life planning and to present some local resources that might be available. And the final part of the project was to create a pilot web-based platform that would provide a supportive environment for information sharing and community building. So what was some of the rationale for the project? The reality is that LGBT older adults, compared to their heterosexual peers, have higher rates of depression, higher rates of suicide, greater exposure to violence, cancer, HIV, and other chronic conditions. They're 3 times more likely to live alone, one third less likely to have partners, 5 times less likely to have children, so their social contacts are not there. And the other thing that we realize is that there is some evidence that LGBT older adults have greater online presence, so the use of an online website we thought would be good for that. Is that not changing? How do I make that happen?
Enter.
Sorry about that.
Try that. Now try. Oh, here comes our.
So I didn't realize the slides weren't changing. So I'll continue till we get back to the slides. So just a bit about the focus groups. We basically did 4 focus groups in each of the 5 locations. We did one for gay men, gay and bisexual men, one for lesbians and bisexual women, one for trans-identified persons, and one for service providers. And the requirements to participate in the LGBT focus groups was that they spoke English or French in Quebec, that they were 60 years of age or older, that they had 1 or more chronic conditions, and that they had some internet experience. And the topics of conversation basically in the focus group was preparations about end-of-life planning, the issues and concerns that they had about aging, the role that community might play in supporting their planning for aging, and the role that technology might play in helping them to do that, to make those plans. So this is just a breakdown of the groups, and so I'm going to talk today about the gay men's group. So really today what I want to talk to you, what I want to do is relate some of the stories that the gay men told us about their realities of aging and planning for end-of-life planning for end-of-life care. So older gay men are often described as doubly invisible in gay-identified heteronormative environments of social service and health, and invisible as older adults in the gay community. So the stigmatization that they experience is double. It's a stigmatization of age and a stigmatization that involves sexual minority status. So what I want to talk to you about today is 4 themes that arose from the discussions with these men in relation to planning for end-of-life, for aging and end-of-life planning, and I'm going to try to do it in their own words. So the first theme is loneliness and isolation, and basically the fact that best laid plans don't often turn out the way that we expect. So sometimes we think that we have everything in place and all our plans are set, and then everything changes. So this quote from a participant in Edmonton: "What did shock me, I had 6 close teaching friends, all my age. We all retired exactly the same day. Within 2 years, all of them were dead. And so whatever retirement I thought I was going to have involving those people, we were all single, it just went. And so I had to figure out a new way of doing things because I just had counted on those people being around." And from Vancouver, a participant who said, "My partner passed away a year and a half ago. We thought we had everything covered when it was the 2 of us, but now everything has changed." Social loneliness and isolation, and the reality of a shrinking social circle. And there's a number of reasons that these social circles shrink as we get older. The reality with gay men is the fact that HIV/AIDS has had a tremendous impact on the social connectedness of gay men. So this quote from Halifax: "We were also living within the survivor's age. The people that died of AIDS during the AIDS epidemic are the people I might have expected to have as friends in my old age." And this quote from Toronto: "I don't have any friends, all my friends have died." And then the reality of the fact that gay men tend to be more transient and more nomadic, perhaps. And so I'm from Vancouver. I was living in California and New York, and I was moving around a lot for work. So not having the ability to build those social connections over time. Then the reality of the fact that social connections do shrink as you get older. This quote from Halifax: "But that's the thing, as you get older, your circle of friends does get smaller." And from Vancouver: "So I really don't know who I would turn to or what I would do because I've outlived everyone." Another aspect of loneliness and isolation is solitude and the fear that arises from that solitude. So this quote from Montreal: "Moi, ce qui m'inquiète le plus, c'est je me couche le soir, s'il m'arrive quelque chose cette nuit, qui va venir m'aider? If I fall asleep tonight and I wake up tomorrow and I can't look after myself, who's going to be there to look after me? Who's going to help me? I've been used to caring for everybody. I'm the caregiver. I'm very used to taking care of them, but then I turn around, I find my car and go away, and I think, who's going to take care of me now?" We are carers very often, and we don't think about who's going to look after us. This quote from Montreal: "Comme il se disait, le gros problème, c'est la solitude." Solitude is the biggest problem. Solitude and isolation. But it's not all doom and gloom. There is a desire to create and generate, to build chosen families, to get involved and to be integrated. So we have this quote from Toronto: "I think there's an urge to create family. We've had a lodging house since 1970. We've raised more children than most. Some of them are gay, some of them are straight, but it's amazing how often they turn to us for parental guidance after they've kicked their parents out of their lives. So I think there's a desire to invent family when you don't have family." And then this quote from Halifax: "I'm a widower now for 12 years. My partner of 26 years passed away, and I'm alone. Am I lonely? Not particularly. I'm busier than the second coming." The next theme is around healthcare resources and the interactions with healthcare providers, which can be good or bad. So conversations arise and situations arise in which providers become uncomfortable or avoidant. So this quote from Toronto: "When I was talking to the doctor, who was terrific on that level, But then I said, well, what does that mean for me in terms of anal sex? Well, he started moving this over there, moving this away, and no more eye contact. I totally lost him, and I thought, he's such a nice guy, but he's being a total prick right now. And then situations in which resources, the resources that are available to us, are heterosexist and heteronormative. I said, how many gays and lesbians do you think you have in the long-term care facility, which is the largest one in Newfoundland? This was a participant in Toronto who had obviously come from Newfoundland. And he says, oh, I don't think we have any people like that. Those were his words. So being hidden in long-term care. The sensitivity of care providers, or the lack of sensitivity of care providers and those who work within the healthcare profession. This quote from Montreal, basically loose translation, he was beginning to develop bed sores, so I called and asked what I should do, and an older woman arrived, flipped him over like he was a mattress, and slapped a bandage on him and said, he's dehydrated, he won't last long, and grabbed her bag and left. There's basically absolutely no recognition of the relationship between these two men. The reality that one person is losing his life partner, his spouse. But then again, there are bright spots. This second quote from Montreal basically indicates that in all of their interactions with healthcare professionals in the healthcare system, the professionals refer to the couple as husbands, as spouses. So there is that recognition. The need for social integration, and in terms of long-term care, it's important to be able to express sexual identity in social interactions with others. So it's okay to play a game and be friendly with people there, but what about social life, your gay life? There's got to be something else. And this second quote from Halifax, but if you're gathered around the table and you're talking about your past partners and your gay partners with straight people who may not be understanding, then it becomes a problem, it seems to me. And then finally, there's the fear of rejection and discrimination in long-term care facilities and the unwillingness to come out. So this quote from Toronto, he managed very well in the nursing home. The saddest thing he did was when he gave us his drag costumes because he wasn't ready to take them into the nursing home. So again, the fear of being out, the fear of being who we are. The next theme is the fear of erasure, of being made invisible. And in long-term care, that can mean having no identity as a sexual being. This older gentleman from Edmonton who says, when you go into these different organizations, the questions I asked is, what happens with the sexuality? Do I have friends in? Can we have sex in the place where I'm at? Or do I have to go out into the back alley? And then there's the reality of the assumed lack of sexuality in older gay men. So this first gentleman from Halifax who says, I'm a 75-year-old man. Nobody wants to be my close and intimate friend, and so I'm not sure that that's available to me. Or the second gentleman who says, because I sure ain't what I used to be and not sure what I'm supposed to be. Am I still gay if I can't have sex? If it was all about sex, am I still gay? Maybe I'm just old, but not gay anymore. And then there's self-enforced erasure. Sometimes it's self-enforced and it's a product of our history. Is that 5 minutes? Sorry. And there's a hope that, that the younger generation won't have to deal with that. Social ostracization and the fear of repercussions of the issue of gender, homosexuality is made public, and the lack of support from organizations that might be in a place to support older gay men. Intergenerational interactions, this is the last theme. There seems to be a conscious effort, or there was a conscious effort on the part of some to seek younger men in terms of care providers. So whether that's professional or informal care, knowing that they'll be around for a longer period of time. And then the reality that some people have younger partners, but that doesn't always work out the way that they want. Intergenerational interactions is looking for Mr. Right or finding Prince Charming. The reality that a lot of older gay men are out there looking for younger men to look after them or to be partners with them. And then this quote from Toronto, the second quote on the page, that some people do have the financial ability to be able to ensure that they have that companionship if they need it. And then the reality of that, looking for that Mr. Right, perhaps backfiring and being an abusive situation where the older person may be taken advantage of. The reality of ageism within the community and the fact that elder people are made to feel invisible, and that older people themselves can be ageist. So I'm really attracted to younger people, so this isn't going to work for me. And finally, the fact of reverse ageism, this last quote talking about younger gay men and not really having it together. So there's all kinds of ageism that takes place within the community. But knowing the need to reach out to the youth, and that the youth, the young people within the community, are the ones who are really going to pick up the torch and carry us forward. So there's a double stigma, the stigma of identity and age, sexual identity and age, the reality of loneliness, and that those needs need to be addressed. That there's a real heteronormativity and heterosexism within healthcare settings, and a fear of being erased as sexual beings, erased as human beings, and a desire and a need to be connected and socially integrated. In terms of intergenerational interaction, there's a certain ambivalence in terms of interacting with younger gay men. There's a need to have them as carers and as lovers, but there's a fear of being used. And there's a real understanding of ageism and realizing the fact that the younger generations are the ones who are going to have to look after us in our older age. Some policy implications, recognizing the differences within the LGBT community. I've spoken today about the older gay men, but we looked at lesbians and trans-identified people as well. And there's a large difference between communities, and we run a tremendous danger in lumping us all together. There's a need to train staffing at all levels of care, long-term care, hospitals, hospices, and to raise the awareness of the needs of the gay population, the LGBT population, and ensure that everyone is sensitive to those needs and issues. And there's a tremendous need to begin to foster conversations about end-of-life planning and end-of-life care. And I think there's a requirement for healthcare and social service providers to ensure that they begin those conversations with their clients and ensure that we are all having those conversations. We all think about them, but I've been working on this project for over a year, and I haven't done my end-of-life planning. So it's easy to talk about it, and it's something that we all need to do. I want to thank you very much for your time. That is the website. If you Google LGBT EOL, so LGBT End of Life, it'll come up easily. I'd invite you to visit it and get some more information, and that's my contact information. Thank you very much.